Hello, and welcome to another episode of the Edmonds Mom's Room podcast. I'm your host, Dr. Allison Felt, owner of Body Motion Physical Therapy, mom of three, and founder of AF Wellness Coaching, where we help moms live fabulous, energetic lives and relieve themselves of the chaos of mom life. So, I am here to chat with you today. I'm putting on my hat as a pelvic expert physical therapist. And if you don't know Body Motion Physical Therapy, we are a very specialized clinic helping people through fertility, pregnancy, postpartum, through menopause. And we help people restore their confidence, improve the function of their joints, improve their core so they can lead absolutely epic lives, right? And we want to do that by just like creating true internal health. And we do that through pelvic floor physical therapy. So what this episode is about today is a little bit harder to talk about. I want to answer the question of what to do if sex does not feel good for you and or if you don't enjoy sex. So we're going to dive deep into it today. And it's actually epically perfect that we're talking about this today because I just finished at the gym, and after I work out and get my lift in, I always have oatmeal with my protein powder and with creatine on it. So I got like a cup of hot water at the coffee shop, and I asked for it half filled so I could put my oatmeal in here and cook it. And on the label it says cup of water hoe filled, and I was like, that's so epic for a episode today about sex. So I have a hoe filled cup of hot water, and it's really half filled, and made my oatmeal in it. But anyways, I thought it was so fitting, so when the lady handed it to me, I just couldn't help but chuckle. And yeah, so here we are. Let's dive into it. I think it is really common for people to go through phases where sex doesn't feel good for them. A, it doesn't feel good, or B, they just don't feel like having it. This is really common throughout the postpartum journey. So after you have a baby, your estrogen plummets, especially if you're breastfeeding. That estrogen can stay depleted for a very long time, and that can have an impact on your sex drive. You just will not have the libido that you probably did previously. And now that libido can also be affected if you are on birth control, and that is a whole nother bag of worms that we're not going to dive into as much today. But I do want to talk to you about what to do if you don't enjoy sex. How can you make it better for you? On Christmas Eve, I got an epic text from a client who was like, I just had my first orgasm in my entire life. And that was the coolest thing to hear, because when you restore the function of your pelvic floor, you can restore the function of having an orgasm. A lot of people end up in their 40s, 50s, and 60s never having experienced the pleasure of having an orgasm. And that's not great, right? Like, if that was the case for men, we would have a lot more solutions. Well, we absolutely do, right? We have a pill that can literally make it so you can have sex if you lose the ability to get an erection, right? But for females, we don't have that kind of option. We don't have that kind of ability to just go pop a pill and make it so we want to have sex, or make it so sex doesn't hurt. That's just not a thing for us. So you might be wondering, okay, but why does sex hurt for me? And there's a whole host of reasons. There are different diagnoses. That's like dyspareunia is one of them. It's where you have pain with anything penetrative. You can have vulvodynia, where your vulva just kind of hurts all the time. And then you can have vaginismus, where your pelvic floor muscles are literally in a spasm, making it nearly impossible for something to enter. And if you spend any time in a heightened nervous state of your nervous system, then what can happen is your pelvic floor can just be semi-contracted. And the reality is, a lot of women are walking around in their sympathetic nervous systems being activated, which causes a reactive spasm and tightening of the pelvic floor. And that pelvic floor just stays in that heightened, tight, alert state and never lets go. Now, you might think, okay, well, that's great. My vagina is going to be tight, and it's going to make sex feel really good for my partner, and it's going to feel really good for me. But that's newsflash, not what we're going for. A tight vagina does not feel good for anybody. And I've addressed this on a few other episodes, but when you have a tight pelvic floor, what happens is you lose your blood flow to a lot of those muscles, making them more fibrotic, making them less healthy of a muscle so that they can't open and contract as well. So then they become kind of dead. And then that's when people often feel like their pelvic floor is super weak. And so when we get that kind of pelvic floor state, it can, if you live in that state for a long period of time, it can just cause a lot of general tension and a lot of fascial tightness, which can then create some scar tissue. It can create some adhesions. It can create inflammation in the tissue. And when we have all that, that can make anything penetrative very uncomfortable. If we have that tension, that can create that pain with insertion, or even if it's just uncomfortable feelings. It might feel a little burny. You might feel like you have to especially warm up. That means that there's something going on in the pelvic floor. So if you are having pain with penetrative intercourse, whether that's with the initial penetration or whether that's with deep thrusting, that means that there's something wrong inside the pelvic floor, that the pelvic floor is just not optimized. It's not working well for you. And you can work with a pelvic expert physical therapist to do some hands-on therapy to help improve the health of these muscles. And therefore, you then can improve your ability to enjoy the sexual experience. And there's nothing better, right? You want to be able to want to participate and connect with your partner or whoever you're engaging with. And if it is uncomfortable, it makes it a lot less desirable. Not to mention whoever you're engaging with, might be like, well, I don't want to hurt you, or I don't want to make this, any worse for you, and you don't seem like you're enjoying it. And it has a major impact in relationships. And so dealing with pelvic floor health and healing the pelvic floor, optimizing the pelvic floor can absolutely change the relationship you have with your partner over the course of the years. And I think it is one of the best things that you can do for your partner. And so the funny thing is so frequently and often when women reach out and they're either trying to get pregnant or they are pregnant and they want to prep for childbirth, husbands will be like, why are you doing this? This is just a waste of money. Just fix yourself afterwards. But the reality is you get your pelvic floor healthy before you conceive or during your pregnancy, you all of a sudden have this dynamic, healthy pelvic floor that's going to make intercourse a lot more tolerable during the pregnancy. So if you want to be sexually active during the pregnancy, some people do. Some people have incredible desire during the pregnancy with all the rush of the hormones, and some people have zero interest at all. Both are completely normal. And so you want to be able to have a healthy pelvic floor, because when it comes to the childbirth process, then the pelvic floor can open and expand, baby can leave the body with a lot more ease, and so therefore the muscle can recover so much faster with that childbirth experience. And so hopefully you see that, investing in your pelvic floor wellness and your health is so preventative in your fertility, conception journey, and then also during the pregnancy itself. So these are just really important essentials that I don't think men realize actually benefit them, because the less damage you have during the childbirth process, it is going to be a heck of a lot easier to get back to being intimate and having intercourse. Because let me tell you, when you have tears and scar tissue and you just experience significant trauma in the pelvic floor and in the pelvis, not a lot of people want to engage in sexual intimacy after that experience. And when they do, they often go back to it and are having to grit their teeth and just kind of bear it. And a lot of times what they'll do is during the intercourse experience, they'll tighten more to try and brace for it. But when we're tightening and bracing for it, it actually makes things worse. So one thing, if you are experiencing discomfort with intercourse, that you can start to do now is you can work on breathing through the intercourse experience. And now I don't ever suggest it bearing through it. I just don't think that's a great pattern for the brain to learn, because if your brain is gritting your teeth and you're bracing during the intercourse experience, like, yeah, sure, you're doing it for connection with your partner or to help please your partner. But if your brain is like, red flag, this is painful, that's going to be a pattern that is now lodged in the brain, and you're going to have to rewire that once it feels good again. So it's not like an exercise you just want to push through and build the muscle up. Like, you just don't want to do that, because if you do that, then you're telling your brain, like, this is a painful experience and your body can't enjoy this experience. So then you're going to have to get yourself back to enjoying, like, rewiring the brain to know that, like, once it feels good again, this is a safe experience. This is a pleasurable experience. But what happens is you have women, and I see this across generations, that after childbirth, they never get really interested in sex again. There's probably some trauma that happened to the pelvic floor, whether that was some tearing during childbirth, the use of forceps, or they had a cesarean. And cesarean absolutely causes a lot more restrictions through the pelvic floor and tightness in the pelvic floor. And again, that tightness isn't good tightness. This isn't like, oh, we created a tight vagina and this is super good for my partner. This is a kind of tension that creates cement, that creates rigidity, that creates fibrous beef jerky tissue that we want to soften and heal, because it's the softening and the healing and the hydration of the tissue that makes the tissue feel really good and feel like you have a really strong vagina and strong pelvic floor. And so that is the goal. And in order to help achieve that goal, we need to be able to get rid of the scar tissue. We have to heal the pelvic floor after we have babies. Now, some people have painful intercourse and painful penetration even before they have kids. Maybe they grew up in a world where touching themselves was, off limits. There was a lot of shame around the pelvic floor and the genitalia, and so they just closed it off and like mentally disconnected. And when we do that, there's a lot of tension through these areas, and that tension can often lead to the diagnosis of vaginismus, where you just get that chronic spasming of all three layers of the pelvic floor. And we have to untrain that and get the brain to be like, this is a safe area. It is okay to touch my genitalia. It is okay to engage with my partner. It is okay to have an orgasm. But if we don't have that mental mindset and this area is still off limits, it's really hard to heal the pelvic floor. So people come here from all walks of life, where they're in the phase of they just got married and they just want to be intimate with their partners, to they are trying to conceive, but they literally can't even insert anything. So they're finding it nearly impossible to be able to have sex during their ovulation cycles. And so then they work through that, right? And it's not just working through the muscle tension, it's also working through the mindset of being able to accept your body and accept the pelvic floor and like learn how these function, learn how the pelvic floor functions. I think a big reason that people never get, like, we never get the education in like 5th grade flash class when you learn about sex of how your pelvic floor functions. No one ever teaches us, like, okay, your pelvic floor and your genitalia are actually muscles. And a lot of times when we're in a heightened state of alertness, or we're exercising, or we're stressing out over an exam, our pelvic floor has a lot of tension in it. And in order to relieve the tension, we have to do some deep breathing and allow the diaphragm to open, which allows the pelvic floor to open. So you can do things called diaphragmatic breathing, and that can help open up the pelvic floor. Well, if we were only taught this in 5th grade flash class or even earlier, then we would realize, like, oh, we have this control of our pelvic floor. Well, the pelvic floor is a deep core muscle and is absolutely essential for the function of our core as well. So if we live in this tightened state of pelvic floor function, then we actually miss out on the eccentric motion of the pelvic floor, which is a big piece of where our shock absorption comes in from the core. And so we have to have that shock absorption to unload the joints and help keep our joints healthy. And that helps keep us free of like SI joint pain or knee pain even, and hip pain and neck pain. The tighter our pelvic floor is, the less restricted it, the more restricted it is, the less movement there is, the less shock absorption happens, and the weaker the core actually is, it becomes less functional. And so therefore we have to train these muscles to have range of motion. When you train the pelvic floor to have this epic range of motion, then all of a sudden sex becomes really good. Orgasms become even better. Because if you have to work really hard for your orgasm, a lot of times it's because the pelvic floor is at such a heightened state and already so contracted. But if you can have a relaxed pelvic floor and you can get yourself to that opening where the muscle can be fully open, elongated, and relaxed, then there's a lot more range of motion to build up for that orgasm, and you don't have to work as hard at getting that climax and getting that peak state of arousal. And sometimes people have such tension that they're just in a constant peak state of arousal, and that when they have like orgasm after orgasm after orgasm, and that is actually very not comfortable, because a lot of times they can't even work out without having those orgasms. So they really have to work on training and opening the pelvic floor in order to get the range of motion, get the blood flow, and take them out of that constant climax state. And so, it works on both ends of the spectrum, but the more range of motion you have of your pelvic floor, the more control you can get of the pelvic floor, the better the sexual experience is going to be for you. And I hope I've made this clear, but also for your partner. And of course, like, the less pain you're in, the more you want to engage with it, the more that you enjoy it. That's also better for your partner. So I take it back to the men that, put a stop on their wives getting like good, true, holistic pelvic floor physical therapy, which is hands-on manual work of the pelvic floor and teaching the pelvic floor how to attain these new ranges of motion and these states of the pelvic floor, and making these muscles super healthy for prevention. That improves your sex life, like the man's sex life. So why not have your woman come here and do this work, right? And that baffles me every time. I don't know how to get the word out other than, like, if this is your husband, send him this podcast and hopefully he will listen to it and be like, oh, my sex life is going to improve. You're telling me that your vagina is actually going to feel even better if you get this range of motion? Like, hands down, I'm in, right? Like, who doesn't want that? But oftentimes, like, just like females, like, men have been sold Kegel culture and like just strengthening the pelvic floor and work the pelvic floor and Kegel, Kegel, Kegel. But let's be real, like, that doesn't help anyone. If you have tension in your pelvic floor and you're already semi-contracting, contracting even more is not helpful, and it's actually detrimental and will make the sexual experience worse, will prevent you from orgasming, and will also wear out your joints in the long run. So do your 50 and 60-year-old self a favor and work through the pelvic floor restrictions. Now, I do just want to talk a little deeper into like the importance of this for relationships. And I've said this multiple times on multiple platforms, and like, I'm no relationships expert. I happen to be married for the last 10 years, but fuck, it's hard, right? Like, there's no like sugarcoating. I have zero expertise in this. I'm just like learning and failing forward, right? And so, and we have 3 children, right? So it's like, we live the chaos and life of being married, and we try to stay married, right, and enjoy each other's company and like remember why we got married in the first place and all that stuff. I have zero expertise in this field, but what I will say is being an observer of my patients and seeing them after they have their babies, the transition from delivery, if we get the pleasure of working with them during pregnancy, this happens a lot less frequently. But what happens often is when we see a new client postpartum, and let me back up. The reason that happens a lot less frequently when they've had pelvic work during pregnancy is because they heal so much faster. They usually want to engage in sex more frequently after delivery because there's just a lot less trauma to the body. So they feel more ready to go. They don't feel the pain that you might feel or the pressure you might feel after having childbirth without any pelvic floor prep. So that's really the value of doing your pelvic floor prep during your pregnancy, is to really prep your pelvic floor so you can, one of the reasons, go back to your sex after childbirth without pain, but also go back to the gym and all that good stuff. So where I was going with that is when we see a new client postpartum and they come to us after having childbirth, like usually there's some scar tissue, maybe some severe scar tissue. And they're oftentimes in coordination of the pelvic floor. So the pelvic floor just loses its function. They feel like they're blown out, like there is nothing there. They feel weak as all get out. And so of course they feel like they need to do Kegels. But the body is like magic, right? So after you have a baby and everything opens up, what happens is reactively the body compensates beautifully and the pelvic floor tightens back up to try and pull the pelvis together, because the pelvis usually separates about 5 to 9 millimeters right at the pubic symphysis joint. So the glutes will tighten to pull the pelvis together, the pelvic floor will tighten to pull the pelvic floor to pull the pelvis together, the bones, and then the adductors, the inner thigh muscles, they'll tighten to pull the pelvis and the pelvic bones back together. And so this is all a compensatory pattern. And you might think, oh, that's great, my vagina's tight again. But again, you'll still have that blown out feeling, or like that you're just completely weak, that there's nothing there, and that you just need to Kegel. But it's because there's no range of motion in the muscle. So all the strength of the pelvic floor actually comes from the eccentric lengthening and elongating and opening up of the pelvic floor, because the more you can open up is the more you can contract. But after we have kids, with that compensation and the body being a magical healer, it already tightened up and like came back together, and you still feel really weak. And it's because you don't have the opening motion. So the opening, the eccentric motion is gone. And so we have to restore that. And in order to get the opening and elongation and the stretch back to the tissue, we have to get rid of the scar tissue that's probably holding it together. And that's tightening it down and not letting it open and expand. So hopefully that makes good sense. And the more that you get that range of motion back, the better your sexual experience is going to be. And you won't have the burning and the pain upon initial penetration. And then with deeper thrusting, when people have pain and discomfort with deeper thrusting, it often means that the third layer of the pelvic floor is really tight. What does that even mean? It just means that the deepest layer of your pelvic floor, including your hip muscles, tend to be really tight. So what people will often say is they'll say, it feels like my partner's hitting something and it's really uncomfortable, so I brace against it. Well, if you feel like your partner's hitting something, most likely it's because your third layer or some muscles inside your pelvic floor that are really deep and connecting to your hips are very tight. Oftentimes we see it as this muscle called the obturator internus muscle, which is a hip muscle, and it is it's a really important muscle, but when it is tight and overworked, it is extremely painful, and it'll feel like your partner is hitting something. And so a lot of times people will be like, oh, they're hitting my cervix. Maybe I have a uterine prolapse and my cervix is coming down out of my vagina, and or my bladder's coming down and that's what they're hitting and that's really hurting. But for the most part, that is just the tension of the pelvic floor, and your partner's not actually hitting your cervix, and your partner's not actually hitting your bladder. Like, yes, the bladder, of course, gets touched every single time that your partner goes in and out of you. Like, that's just par for the course. The bladder is sitting on the anterior wall of the vagina, so there is going to be contact there. The cervix is sitting at the top of the vagina, and so if your partner is really big, like, you will have some touching of the cervix. That should actually not be painful though. And so if it is, there might be restrictions around the actual cervix itself. So you might be sitting there thinking, okay, Allison, what is a pelvic floor physical therapist actually gonna do to help change these muscles for me? Well, there's a lot of things. They're gonna teach you how to work your pelvic floor muscles. They teach you how to work your pelvic floor muscles by using some breath mechanics, by doing some stretching, by learning how to truly work and engage your lower abdominal muscles. Most people can't actually engage their lower abdominal muscles. And then especially after they grow a baby for 10 months, it is so hard to engage the lower abs. and then just forget about it if they were cut with a C-section. That is one of the hardest things to get back. And so if you don't have lower ab control, it's actually really hard because then the pelvic floor overworks to compensate for that lower ab control. So we got to get the lower ab control back, which, side note, aesthetically helps flatten your stomach, right? So we all want that, or maybe you don't, but like getting that control back is going to be absolutely epic, and unloading the pelvic floor. Unloading the pelvic floor is then going to allow that pelvic floor muscle to be more hydrated, more dynamic, have more movement. And so we teach the pelvic floor how to start moving again, along with training the lower abdomen and restoring the rest of the core muscles. So we got to get the diaphragm moving, we got to get the back muscles and the glutes firing. Training your glutes and getting hip extension back after you have kids is very important, because hip extension is one of the things that we lose during the pregnancy process. As we grow a baby, we have more anterior load, and therefore our leg doesn't go as far behind our bodies. So we lose hip extension, which means that we lose our glute activation, which is a big reason why we have the moms have a flat butt phenomenon. But when you have a flat and tight butt and the butt is really weak, then there's a lot of tension there. And if there's a lot of tension there and you're gripping your butt a lot when you're standing or doing other activities, like even just like washing the dishes, if you find yourself clenching your glutes, like you're also clenching your pelvic floor further, which is then going to mess up your pelvic floor range of motion, creating a lot of generalized tightness, which is then going to lead to that soliloquy of sex not feeling as good. And so the more we can get that range of motion and heal that, the better. So back to what the pelvic floor physical therapist does on top of doing all that other work is they will do an internal and external assessment of the pelvic floor muscles. So they'll look at all the pelvic muscles on the outside of the pelvis. This includes the glutes, this includes the hip flexors, this includes the abdomen, this includes everything that you can imagine that connects to the pelvis. Those muscles will be evaluated, and make sure that your compensation patterns can be broken up, and then we can train the muscles to do the healthy movements that they are supposed to be doing. That's all about, restoring our body's motion. And, I'm talking about this often in like relationship to like healing after childbirth, but the reality is like a lot of people have this pattern even without having kids. And so even if you haven't had kids, if you have this tension pattern, this is like a really common compensation. You don't just have to have kids. Having kids exacerbates this even further. But a lot of people who don't have children also experience these issues and have these very similar patterns. And then we also look at the pelvis inside. And when we look at the muscles on the inside of the pelvis, we do this through looking at them intravaginally. So we'll have a gloved finger and you'll be draped with sheets, and we'll gently insert a finger and test the different layers and muscles of the pelvic floor itself. We'll be checking for scar tissue, adhesions that are found within the pelvis, and really working to improve the extensibility of the tissue, which means that we're just looking to stretch and open and hydrate these muscles, making them very, very healthy. We do this on all three layers of the pelvic floor, and you can also do this intrarectally, and that's how you assess male anatomy, is through the rectum. And there are certain conditions and diagnoses that will respond better to intrarectal work, but a lot of times intravaginal work is a lot more tolerable just because you don't have to work through the anal sphincter. And sometimes it's hard for people to relax their anal sphincters and then be able to relax their pelvic floor. Working through the pelvic floor is absolutely essential, and not everyone wants to do that. Fully understand, but if you can get to a point where you're able to work through your pelvic floor and heal these muscles, fix any scar tissue, it can epically improve your sexual experience. And not to mention, it just gives you a different connection to your body and allows you to use your core in a way that you've never experienced. This is in a way that no amount of planks, sit-ups, crunches could ever train your core. When you get this control of your pelvic floor, you will be able to engage your lower abs, you'll be able to engage your core and allow your core to function in new ways that you never knew existed. People that experience like low back pain, SI joint pain, usually have really tightened pelvic floors because the pelvic floor is spasming and tightening to try and protect the back and protect the SI joint pain. But a lot of times it is creating even more pain patterns because of the compensation. So, which then can lead to uncomfortable intercourse. So that's what we're looking at. So when someone comes in for a pelvic floor exam, that's what we're going through. So it's an internal and external exam, and we get healing. And it takes the body time to heal. If this is, it just depends. It can be a 6-week experience to a 6-month to a multiple year experience, depending on how the severity of the pain is. But just to improve your sex life, that can happen fast. Just start getting some motion, some blood flow here. Start getting the pelvic floor to function and actually do the movements that it was trained to do. And you will have epic changes to your sexual experience. And now you might be wondering, are there devices that can do this for me? There are certain things like wands, there's certain things like vaginal dilators, and they have their place. I find it is already, most people don't know what they're feeling when they feel their pelvic floor. So it's really hard to know where you're sticking a wand. Am I actually putting this wand in a muscle that's going to release? And this wand would go in intravaginally. And so for that, just so someone doesn't hurt themselves further or cause more pain, I always say it's most ideal and gold standard, find a pelvic floor physical therapist that you know, that you like, that you trust, can help you get full function and range of motion of your pelvic floor. And you're going to have to keep working on it. We have a maintenance program here at Body Motion where people come once a month just to help restore and keep their range of motion of the pelvic floor. Because the reality is life is stressful. We just had the holidays, right? And my pelvic floor was so tight, I started leaking some urine again. That's what can happen when you have tension through your pelvic floor, and sex wasn't feeling super good. Then I had a couple sessions of pelvic floor because I had skipped a month. I had skipped my session in December, and I had a couple sessions and fixed. Just like that, pelvic floor is working and functioning way better. Even my lifts and my workouts are so much better because my core engagement is better. And so all of it is so related. And the best thing that you really can do for yourself is learn how to use your pelvic floor. Get these muscles so extensible. Work with someone who can help you achieve that goal. And it will play a huge role in your relationship, in your ability to stay sexually active with your partner. As our hormones change and we go through perimenopause and menopause and we lose a lot of our estrogen and progesterone balances, what can happen is we can lose hydration of the pelvic floor, we lose lubrication, and that can make the muscles weaker because then they go to that state that they were essentially in postpartum where they just tighten back up, they lose range of motion. The more you keep the health of your pelvic floor muscles, the more you keep that range of motion, the more you're actually going to keep natural lubrication independent of having your estrogen and progesterone balanced. So the healthier this muscle is, the more dynamic it is, regardless of your hormonal state. It actually can, if you keep it healthy during perimenopause and during menopause, then after menopause, it's going to stay in that healthy state as long as you continue to work it. What happens to a lot of people, and this is what we see in the nursing homes, right, when they're in their 70s, 80s, and 90s, is they never had pelvic care after they had babies, or even just in general in their lives. And so they're peeing their pants, they're in wheelchairs, they're in diapers because their cores don't work, can't get their core to work no matter how much physical therapy they do and how many times they've been to physical therapists and trainers in their lives. And it's a lot of it just goes back to they never had this core function in the first place, right? So then I'm going to take it all the way back to that 5th grade flash class. And if we can just teach kids how their pelvic floors function and how their genitalia move, then we can give them lifelong health, right? Will you still need maybe some help in keeping the range of motion? And absolutely. But if you can keep your core functioning, you learn how to function your core and work your pelvic floor in an opening range of motion when you're in 5th grade. Can you imagine what that does for you when you go and have your babies? And how do we teach this? Well, you teach this by teaching someone how to have a bowel movement. When you have a bowel movement and you learn how to open your pelvic floor by breathing and controlling your pelvic floor and not just sitting there and pushing the poop out, then you get to have amazing control of the opening. So then you get the eccentric motion, and when you learn how to do that, then all of a sudden you know how to have that range of motion of your pelvic floor. So we just got to teach kids how to poop. We also got to teach them how to pee so they're not pushing their pee out, because that is absolutely detrimental to their pelvic organ positions and to different conditions that can happen. And so we just have to teach people how to have good bowel movements, how to have good pees, and we'll be good to go, right? But the reality is like also then is that information received and whatever. It's a rabbit hole that I'm not going down. But I absolutely think that like we can at least teach our own kids that, and we can start to make an impact in them improving their pelvic floor function just by teaching them how to poop and how to pee. And you can check out my YouTube channel. There's about 1 million videos about how to have a bowel movement properly and how to pee properly. So just a little side note for you there. But I hope you have enjoyed this episode. I hope you now have confidence that if you're not having orgasms, you'll be able to one day. I hope that you have confidence that if sex is not comfortable or not your favorite thing, that you know what needs to be done in order to help improve your experience. And I'm just gonna leave you on that note. So thank you so much for being here with me today. I have a great pleasure of bringing this information to women across the world, and our goal is to change humanity, to change women's healthcare, to change women's wellness so that we can live freaking amazing lives and feel really good in our own skin and feel really good in our own skin. Because when we feel good in our skin, then the impact that we can make to improve humanity for the good is wild, right? Like it's the potential is endless. And so I wish that for you. And get control of your pelvic floor. See a pelvic expert physical therapist. There is nothing better than having range of motion of your pelvic floor, being able to enjoy your sex life,